Cancer is the name given to a collection of related diseases. In all types of cancer, some of the body's cells begin to divide without stopping and spread into surrounding tissues. Do you know 10 million people around the world die each year from cancer? And the common 5 leading sites are breast, lung, mouth, cervix, uteri, and tongue. At Medicircle, we are conducting an exclusive interview series on the occasion of World Cancer Day, showcasing eminent oncologists over a discussion to bring awareness about cancer, its treatment, and myths related to it. Hi, this is Sana Khan, and today in this initiative, we are going to speak to Dr. Sameer Kaul. He is a senior consultant surgical oncologist and robotics at Apolo Cancer Institute, New Delhi, where he heads the Surgical Oncology Unit 1 and has vast experience of working at number of reputed Mumbai hospitals like Tata Memorial, Nanavati, Jaslok, KEM, Breach Candy, and the Royal Marsden Cancer Hospital, London. He is the founder president of a successful non-governmental organization called BCPBF, the Cancer Foundation, and his interest lies in popularizing innovative techniques in oncology. Hello, Dr. Sameer Kaul. Welcome to Medicircle.
Good afternoon, Sana. I'm very thankful to Medicircle for having me this afternoon to talk for the World Cancer Day.
Pleasure is all ours, sir. Okay, so to begin with, there are 3 most common types of cancer in India: breast cancer, cervical cancer, oral cancer. Are they curable, and if yes, how?
Well, the fact is that, first of all, you're right in your observation that in the women, breast and cervical cancer are respectively the commonest cancer and the second most commonest cancer. And as far as both males and females are concerned, oral cancer is probably the topmost malignancy in this part of the world. And everything, you see, most of the cure, when you're talking about cure actually depends on trying to treat these cancers early.
Okay.
The earliest stage that you can get these cancers for treatment, it is very important to catch them early when they are either, of course, it's always best to prevent a cancer, which means not let it happen at all.
Right.
But if you cannot do that, the next best thing is to try and diagnose a cancer early. And if you diagnose it early and it gets treated by the right people, which means it goes without wasting of time and does not get treated by people who are not trained to treat it or not equipped to treat it, or hospitals which don't have facilities and expertise to treat such a cancer, then if it gets treated at the right place and you reach to this right place at the right time, which the right time I mentioned to you is early stage disease,
right.
Whether it is breast or it is cervical or it is oral cancer, if it gets at the earlier stage 1 and 2, then when you treat it using surgery and radiation and chemotherapy and some targeted therapies like immunotherapy and all that have come in now, and a combination of these is used to treat them, and the right decisions are made by a tumor board in that institution, which comprises a surgeon, a medical oncologist, and a radiation oncologist, all sitting together and decide which modality to use when. And when it gets treated like that by people who are trained to do that, obviously the results are better. And when I say results are better, then I'm talking about survival, chances of survival. When you say cure in oncology, in cancer, is actually measured in terms of 1 year survival, 2 year survival, 5 year survival, 10 year survival. And in some cancers, even 50-year survival. There are some cancers where people live long when you treat them. So you talk about 50-year survival. So you're talking about the overall survival. You're talking about something called as disease survival, which means that the person is present without the occurrence of the disease in the body. Disease-free survival after having been treated is very good when you treat at the right time and it is treated by the right people. So cures are possible. I'm again repeating, that we must diagnose all these three cancers that you talk about early. So when you talk about early, and I also mentioned to you that in fact prevention, not allowing these cancers to happen at all, is the best
Right.
modality, is the best thing to happen, because an ounce of prevention is worth a pound in cure. We all know this adage. So it is true in this case. You spend, when you treat an active cancer, you occupy a hospital bed, you occupy finance, which means you use money and resources, use time, energy, and the kind of physical and psychological agony that goes with it can
Right.
all be avoided if we prevent it and we don't let it happen.
True. Okay. Dr. Sameer, does cancer have symptoms or is it asymptomatic?
Most of the cancers have symptoms.
Okay.
What are symptoms? Symptoms means what anybody would complain of.
Right.
Anyone who develops cancer in his or her body, whatever they would complain of is called symptom. What
Right.
a doctor finds on a clinical examination is a sign, but what a patient complains of is a symptom. So
Okay.
most of the cancers do produce subtle symptoms. Now it
Okay.
depends, some of these symptoms in some, most of the cancers can come early, for instance,
Okay.
and that would depend on where the cancer is situated. If the
Mm-hmm.
cancer is situated on the surface of the body or somewhere which is clearly accessible to the
Mm-hmm.
patient himself or herself, or to the examining hands by a physician, then you can have those symptoms. If they press on a nerve nearby, if there is a cancer, there is a nerve nearby, and it involves that nerve early, so you get pain, and that
Okay.
symptom comes up early. Now, if you are next to a blood vessel and you get blood coming into that area, and then therefore people have hemoptysis, which means they cough out blood, or
Right.
there is bleeding from anywhere, so that can be seen. And if it produces a big lump or something and it causes pain and discomfort for that pain, or sometimes let us talk about the gastrointestinal tract. If there is a difficulty in swallowing,
Mm-hmm.
food sticks somewhere, or if you get difficulty in passing stools, and your stool habits change, which means the lumen of the bowel is getting obstructed by a
Right.
mass lesion which is not allowing to food to pass through, so symptoms will come early. Vomiting
Okay.
will happen, diarrhea can happen. Now same, let us talk about the respiratory tract. Now if in the respiratory tract you get a tumor which is impinging on the lumen of the respiratory tract, there are bronchial pathways, and you can get hemoptysis, you can get breathing difficulty, you can get a cough which doesn't go away, you can get
Right.
an alteration of voice.
Mm-hmm.
There are other symptoms which come very late in the disease, that is loss of appetite and loss of weight. That happens very late. But in some cancers, while most cancers give symptoms early, they may be subtle. There may be just a mild dyspepsia, which
Right.
means a heartburn and acidity, which we don't take cognizance of very seriously. We
Right.
start using antacids, we use Zintac, we use Digene and all that. We self-medicate,
Mm-hmm.
or we just take antibiotics. And sometimes in our country, it is very important to mention that in various parts of our country and also in the developing world, for instance, it can people get treated for tuberculosis for 5 months, 6 months, till they realize that it was actually a cancer. That also
Right.
happens, but that happens only if you rush into treatments without investigating properly. That
Right.
happens when you don't take your symptoms that seriously. And
Seriously. Right.
unfortunately, if the physician also doesn't take your symptoms that seriously and gives things like antibiotics and symptomatic treatment, for the pain, for the fever, or whatever the symptom may be. So the symptom will be always, most of the times, there, but they may be subtle and may be ignored. But in
Right.
some cancers, like in the abdomen, like happens in the case of a gallbladder, that
Right.
you get a little bit of a burp, and
Mm-hmm.
you till late it doesn't cause any problems. Similarly, some stomach cancers, till they obstruct for a long time, they may continue to grow in your body. Same in the colon, same also in the abdomen, in the ovaries particularly. Ovaries are very
Okay.
notorious, that because there is a lot of space around it, and there is no immediate impingement or involvement of a nerve or any other organ which or obstructing thing that happens
Right.
early, till because there's a lot of space, so it keeps distributing and becoming bigger in that space without involving any other secondary organ and doesn't cause any symptoms. And then suddenly one fine morning, when you realize and you get diagnosed, you're already stage 3 or stage 4 and quite late. And people get shocked. And quite rightly so. They get shocked because they say we didn't have any symptoms.
Right.
But the real answer is that, unfortunately, Sana, in this today's world, when we become more stressed, and we are continuously involved with trying to live a good life and trying to create conditions to create a life, we've stopped talking to our bodies. There is no time to listen to our bodies. So if our body is trying to tell us something by producing subtle symptoms, we choose to ignore them. And therefore, it is very important. Like I'm saying, one must listen to one's body. The body always tells you, look, whatever you're doing with me, the kind of food that you're giving, or whatever you're making me subject, it's not right. But we don't choose to listen.
True.
And we don't choose to take cognizance of it. So you have to be sensitive to your own body and keep your own health at the top of your priorities. And now, even after the pandemic and corona, if you don't do that, then you have to be a dumpkin. I mean, then that means you haven't got it still. That you got such a rude shock, and this pandemic told you that how important your health is. And even after that, if you choose to not give time and mind to your own body, then that's not it. So my advice is that listen to your body, talk to your body, give it time, take your symptoms seriously, try and get an answer for those symptoms. See your physician at the right time. Believe me, your symptoms are there, don't ignore them. Unless, of course, you get very, very unlucky and you don't, and then it goes to stage 4. Very infrequently, there will be no symptom. Most of the times there is a symptom. It may be subtle, but there will be a symptom.
Very well explained, Dr. Sameer. It's so clear to me to understand what you've said. So I'm sure it helps people around. Okay, moving on with the next question. With the passing years, there has been an increase in the number of cancer cases. According to a study in India, with a population of 1.35 billion, witnessed as many as 1.16 million new cancer cases and 7,84,800 cancer deaths in 2018. What are the reasons and how can they be controlled?
What are the first? You asked me a couple of questions. That they are going because
Dr. Sameer,
cancer is a part
I'm sorry to interrupt.
This.
Hello. Your voice is not.
Can you hear me?
No, your voice is cracking badly, and you're not audible. Your voice is cracking.
I'm not audible. Can I?
Your voice is cracking.
Yeah,
there is some
cracking?
Internet. Yeah, there's some internet issue on your side, I think.
Yeah, I'm just trying to sort that out. Just give me a minute.
Okay.
The voice was cracking. Can you hear me now?
Yes, you're clear.
It's clear now. Okay.
Right. I'll start with the third question again.
Yeah, go ahead.
So we can do the editing and start it from there.
Yeah.
Okay.
Okay.
So with the passing years, there has been an increase in the number of cancer cases. According to a study in India, with a population of 1.35 billion, witnessed as many as 1.16 million new cancer cases and 7,84,800 cancer deaths in 2018. What are the reasons and how can they be controlled?
Well, the fact of the matter is that first you have to understand there is a change in the demographics of the cancer worldwide. It's not, I don't know whether your question was specific only to India or the developing world, but are we talking about globally? But let me talk about globally and then bring in India. Yes, there is an increase in the cancer load, and they're saying that in 2030 there is going to be what the WHO calls a cancer epidemic, which means large number of cases in this part of the world. India, you're aware, is a lower middle income group country, and so are the countries around us. We fall in that zone as per our, the World Bank classification that is normally used in such circumstances. For a long time, this country and our countries, people were dying of communicable diseases. And communicable disease meant diarrheas in children, perinatal mortality, people dying of infectious diseases. Of course, the corona has come in again, but in between, what had happened is that we were saving all these infectious people. This viral illness has come in now to rudely awaken us again. But for a long time, we had realized that now the main disease load in the world is what we call as non-communicable disease. Right. And a non-communicable disease means diseases like cardiovascular disease, heart disease, hypertension, and diabetes. Diabetes and cancer. Cancer is number 2. Now, these are diseases which come with the lifestyle, the newer lifestyles that have come into the world. These are the food that we use, the clothes, the coloring agents, the ingredients in various things, in our environment. These are lifestyle diseases. Now, these lifestyle diseases load has increased, and it's continuously increasing in the whole world, and so also in our part of the world. Now, another thing that has happened, age expectancy has gone up. So people whom we saved from dying because of communicable diseases are all surviving now, but they are surviving. But what is happening to them, because the age expectancy has also gone up, which means earlier people would die at 65, 66, a lot of people would die, but now they're still alive even at the 80s. So when that life has increased more, the diseases, non-communicable diseases, including cancer of this age group, have gotten added on. And these diseases means that elderly people are prone to a lot of cancer. For instance, I talk about esophageal cancer, you talk about stomach cancer, you talk about breast cancer, you talk about rectal cancers, you talk about prostatic cancers. They are commoner in the increased age group, higher age group, which means 70s, 70, 65, 80, a lot of people. Earlier, when you were dying at 60 only, so you were not suffering from these diseases. So the numbers were low. So the population is going up, people having more expectancy, life expectancy. So that has got it added on. The people you were saying from infectious illnesses like bacterial diarrhea and protozoal diseases have all got shifted into the non-communicable disease spectrum. And at the same time, another thing that has happened, information technology and communication has increased so much. Earlier on, we never kept any records. We never talked about these things. Awareness levels were low. It is unimaginable that 20 years back, Sana Khan and Dr. Sameer Kaul would be sitting across and talking about the cancer on a World Cancer or around a World Cancer Day. It wouldn't happen. It was something people would just die of, and you know why they would die. They would say, "Oh yeah, either tuberculosis se death ho gayi, ya mar gaya." We wouldn't know. Now today there is a name to it. You can recognize it. People talk about it. There is a terminology. It is recorded. And at the same time, what happens? So people realize there is a name to it. So you hear about it more. It is recorded more. We talk about it more. So that also adds on to it. So all these factors combined have increased the load, and our lifestyles that are changing, becoming more permissive to the change of all the causative agents that cause cancer. Genetic, we are recognizing the role of genes in our creation of cancer. So all these things are creating a scenario where you have large number of cases coming up, and more, the non-communicable disease is a wide, big killer now today for the human beings. and we have to confront that. On the other hand, our resources are low. Our public health spend is low, which means, for instance, let's talk about the budget that we spend for our health. Let me start from the top. When we talk about strategy and policy, first of all, there is all over the world the kind of load, financial load. Do you know that cancer is the largest cause of out-of-pocket bankruptcy in the entire world? Even the rich countries like America, Canada, North America, these rich countries, people, the so-called developing world, even there is not enough resources and finances to combat the rising levels of diseases like cancer, because they put a tremendous impact on your social state. What is required now, whether you are paying yourself or the government is paying or the insurance sector is paying, but somebody is paying all right. So whoever is paying, there is not enough money for them to be spending on the number of cases that are coming up, and that is throughout the world. In countries like our countries, the impact is more because we are low-income countries. We have that many more resources, less resources, and our budgets on our health are not that high. They're something like very meager, 3.5 or 3.4% or so, which is not adequate at all. That budget needs to go up. Public health spend needs to go up. Particularly now the corona has taught you even better. You have to be spending more on the public health of your country. It's very important because it has an impact on the economy, on the future, on the workfulness of that country. So on the health of that country, all financial, social, everything depends on your health condition. So if your indices don't improve, the strategy has to be number two. You have to drive value into the system. What is value? It means whatever money be worth that. There should not be a disproportion between the amount of money that you're spending to treat a disease and what you're able to spend. Number two, all your protocols, you should follow protocols. So there is no wasteful expenditure. So there should be institutionalized protocol, countrywide protocol for treating a particular stage of a cancer and a disease, which everyone follows. It can't be that some people follow one method, and so the cost is like this. Some people follow other methods, and the cost is like that. So you have to have uniformity of protocol. Number two. Number three, it is very important to have screening programs so that you can prevent cancers and detect them early. And when you do that, you get not only good results and you save more people, you bring down the mortality rate, but you treat less with lesser money and lesser resources and lesser energy. And, so the efficiency of the system becomes better. So value, this word value in medical practice is very, very important. It's important in other subjects also, very important in oncology treatment. You have to drive value into the system. Number three, there has to be a good, equal and homogeneous distribution of infrastructure, like treating hospitals, like on cancer hospitals. They have to be widely distributed across the country. Now, at the moment, what we are seeing is a maldistribution. In one area of South Delhi, there will be 5 hospitals, and in lots of swaths of territory, there will be no hospital at all. So they should be decentralized. They should be accessible to all sections of the population. Number one, distance-wise, geographically, and financially. People should be able to afford good medical treatment. Now, as you know, costs of medical treatment are going up. The newer drugs like targeted therapies, which give you better results at lesser side effects, are very expensive. For instance, immunotherapies, most of us cannot afford them, and the insurance is finding it difficult to pay for them. So we have to think about bringing those costs down. And the only way those costs can come down is if we create enough research and development, original research and development places in our own country. So hubs, innovation hubs and research, clinical research and laboratory research in our country must be promoted. And we must be Atmanirbhar in this. We must produce our own instruments. We must produce our own gadgets. We must produce our own drugs. Even the high R&D products like immunotherapies and all. At the moment, most of what is happening in this country is copycat research, which means there is a patent somewhere else. You just copy it, and we must respect patent rights, and we must do original research. It must be paid for very well. The salaries of these research people must be good. We must place these research people across the universities of these countries, encourage them, pay them well, look after them, nurture them, get them collaborations with the rest of these research places and universities abroad or elsewhere, so that the whole thing becomes standardized. Now that will bring down the costs of drugs, and that will bring down, it will increase accessibility of all Indians, all humans, and everybody will get the same kind of treatment, and that treatment will be standard. So human infrastructure, which means to train people to detect cancers early, to treat them well. So human infrastructure and technical infrastructure, which means hospitals, radiation therapy machines, research centers, and protocols being followed in them. If you do all these things, and I'm sure it's happening. I can't say that it's not happening in my country. It is. And I'm happy that is happening. It is a bit slow. We are a large country. We have issues about inadequate distribution. Hopefully, things will only get better. And I can assure you, and it has gotten better. I mean, for instance, a few years back, cervical cancer was now cancer number 1 in women. But now it is number 2. It's still common, but breast cancer is more. Why? Because we were able to improve the hygienic conditions of people living in this country. They were all clustered together in these urban shanties. They're able to live a cleaner life with lesser genitourinary viral infections, and therefore the incidence went down. And pap smears started happening. But we must drive preventive programs in this country. We must have pap smears done. We must have screening programs for breast. In fact, breast, colorectum, breast, cervix, colorectum, and oral can be done in the same checkup. And for instance, what do you need to do? In an oral cancer, you just need to do a clinical examination and maybe use a little bit of a vital dye to pick up a hyperactive place and biopsy it. So a properly functioning system at all levels. We need to make improvements at all levels, right down from the budget that is kept to every person becoming conscious of standard protocols that have to be used and proper functioning of institutions. If we do all these, coupled with the research, and we enhance it in this country, I'm sure we'll be able to achieve what we want to, which is to have lesser number of these cancers coming up for treatment, which is to treat them well and treat at the stage so that we can get good results for our patients, and we can all be happy, the patient and the doctor and this country, and everyone have a healthy country.
Right. Okay, thank you so much, Dr. Sameer, for coming to our show and sharing your valuable time and insights with us. It has been a pleasure having you on the show.
It's been a pleasure. Namaskar.
Thank you. Namaskar.